The dismissal problem. Your doctor says, you're just tired. It's stress. Try exercise. Your friends say, everyone's tired. That's life after 50. You accept it. Maybe it's just aging. But here's what nobody tells you. Your body is screaming signals that something specific is wrong. Not getting old. Not just stress. A specific treatable deficiency. The problem, these signals are so common. They get dismissed. Doctors see them 100 times a day. Your friends experience them too. So nobody recognizes them as warning signs. You're not lazy. You're not weak. You're deficient. In the next 8 minutes, I'm going to show you 5 body signals that women constantly ignore, what they actually mean, and exactly what test to ask your doctor for. Because once you know what to test for, the fix is often simple. Low ferritin. Signal. You're exhausted, bone tired. Coffee doesn't help. You sleep 8 hours and still wake up tired. What people think? I'm just tired. What's actually happening? Low ferritin, iron storage. Here's the distinction. Iron in your blood, serum iron, versus iron stored in your cells, ferritin. Your body can have normal serum iron, but depleted ferritin. Your cells are literally starving for oxygen. Without adequate ferritin, your mitochondria, the energy factories in your cells, can't function. You're not tired because you're lazy. You're tired because your cells can't produce energy. Women are especially prone to iron deficiency because of menstruation. Even if you think you have light periods, you're losing iron monthly. Postmenopausal women can deplete ferritin over years without replacing it. A 2018 study in Nutrients found that women with ferritin below 30, normal range is 30-300, reported 3 to 4x more exhaustion compared to women with ferritin 70+. The symptoms: exhaustion that sleep doesn't fix, brain fog, difficulty concentrating, shortness of breath with minor exertion, pale skin, less oxygen in blood, brittle nails. What your doctor will likely say: your iron is normal. Checking serum iron, not ferritin. What to ask for? I'd like my ferritin tested specifically. Not just serum iron, ferritin. Doctors often skip this test because serum iron is cheaper, but ferritin is the real indicator. The fix. If ferritin is low, under 50, iron supplementation. 3 to 6 months of consistent supplementation brings it back up. Suddenly, energy returns, brain fog clears, shortness of breath disappears. Thyroid dysfunction. Signal. You're tired. You're also feeling colder than everyone else. Your hair is thinning. Your skin is dry. What people think? I'm getting old. What's actually happening? Your thyroid is crashing. Here's the problem. Thyroid disease in women is massively underdiagnosed. Doctors check TSH, thyroid stimulating hormone, but often miss actual thyroid dysfunction. Why? Because TSH normal range is broad, 0.4-4.0. A woman can have TSH 3.5, technically normal, but still have dysfunctional thyroid. The normal range was designed for the general population, not for optimization. Additionally, Hashimoto's, autoimmune thyroid disease, affects women 7 to 10x more than men. But women are rarely tested for thyroid antibodies, TPO, thyroglobulin, only TSH. A 2017 study in thyroid found that 1 in 8 women have thyroid disease, but only 1 in 25 are diagnosed. The symptoms: exhaustion, different from low ferritin. It's a metabolism slowdown. Cold intolerance, feeling cold when everyone else is warm. Hair loss or thinning. Dry skin. Brain fog. Weight gain, despite eating normally. Slow metabolism. What your doctor will likely say: your TSH is normal. Checking only TSH, missing antibodies, and free T4-T3. What to ask for? I'd like a complete thyroid panel. TSH, free T4, free T3, TPO antibodies, and thyroglobulin antibodies. Most doctors will resist. Push back. Say, I have symptoms and want to rule out autoimmune thyroid disease. The fix. If thyroid dysfunction is found, thyroid replacement, levothyroxine, or natural desiccated thyroid. Typically, 6 to 8 weeks to feel difference, 3 to 6 months to feel fully recovered. Suddenly, energy returns. Temperature sensitivity normalizes. Hair stops falling out. Vitamin B12 deficiency. Signal: you're experiencing tingling in your hands or feet, or numbness, or nerve pain. What people think: It's neuropathy, just part of aging. What's actually happening? B12 deficiency, pernicious anemia. Here's what's dangerous. B12 deficiency doesn't just feel bad. It damages your nervous system irreversibly if left untreated. Your nerves need B12 to create myelin, the insulation around nerve fibers. Without B12, myelin degrades. Once it's damaged, it's hard to repair. Additionally, many women have difficulty absorbing B12 from food, need stomach acid, intrinsic factor, etc. Vegans, vegetarians don't eat B12, only in animal products. Older women have decreased stomach acid, less B12 absorption. A 2016 study in the American Journal of Clinical Nutrition found B12 deficiency in 26% of women over 50, most undiagnosed. The symptoms: tingling numbness in hands or feet, nerve pain, weakness especially in legs, cognitive issues, confusion, memory problems, fatigue, different quality than iron or thyroid, neurological exhaustion, mood changes, depression, anxiety. The critical point: unlike ferritin or thyroid, B12 deficiency has a window of reversibility. If left untreated for years, nerve damage becomes permanent. What your doctor will likely say: your B12 is normal. Checking total B12, not active B12, or methylmalonic acid, the true indicators. What to ask for? I'd like my B12 tested, specifically active B12, holotranscobalamin, and methylmalonic acid, not just total B12. The fix: if B12 is low, injections, B12 shots monthly or bi-monthly. Oral supplements don't work well because absorption is the problem. Injections bypass the gut entirely. Suddenly, tingling stops, energy returns, cognition clears, mood stabilizes. Magnesium deficiency. Signal: you're experiencing muscle cramps. Your sleep is terrible. You're tense constantly. What people think: I need to stretch more. I need to relax more. What's actually happening? Magnesium deficiency. Magnesium is critical for muscle relaxation and sleep. Without it, muscles stay contracted. Your nervous system stays activated. Sleep is impossible. Additionally, magnesium is depleted by stress. Cortisol dysregulation uses magnesium. High caffeine. Coffee depletes magnesium. Poor diet. Refined foods have no magnesium. Medications. Birth control, antacids, diuretics all deplete magnesium. A 2020 study in nutrients found magnesium deficiency in 43% of women over 50. The symptoms: muscle cramps, especially legs at night, restless leg syndrome, muscle tension, neck, shoulders constantly tight, poor sleep quality, waking multiple times, not restorative, headaches or migraines, anxiety, irregular heartbeat, palpitations. The problem: most doctors don't test magnesium, and blood magnesium tests are unreliable. Only 1% of magnesium is in blood. 99% is in cells, thus bones. What to ask for? I have muscle cramps and sleep issues. I'd like to try magnesium supplementation. Can we rule out critical deficiency? Don't wait for a test. Just supplement. Magnesium is safe. Worst case, loose stool, which tells you to reduce dose. The fix: magnesium glycinate or threonate 200 on 400 millimers before bed. Within 3 to 7 days, muscle cramps reduce, sleep improves, tenseness decreases. Within 2 to 3 weeks, deep sleep returns, energy improves, anxiety decreases. Vitamin D deficiency. Signal: your mood is worse. You're more anxious, depressed. Your bones ache. Your immunity is weak, getting sick constantly. What people think: it's getting older. It's stress. What's actually happening? Vitamin D deficiency. Vitamin D is not actually a vitamin, it's a hormone. Every cell in your body has D receptors. It affects mood, bone health, immunity, and blood sugar regulation. During winter, or in northern climates, or if you avoid sun exposure, understandable for skin cancer prevention, you become deficient. Women are especially at risk because postmenopausal women can't process D as efficiently. Women use more sunscreen, blocks D production. Women with darker skin produce D more slowly. A 2021 analysis in nutrients found D deficiency in 41% of women over 50 in North America. The symptoms: depression or worsening mood, anxiety, seasonal mood changes, worse in winter, bone pain or aching, slow wound healing, frequent infections, weak immunity, muscle weakness. What your doctor will likely say: your vitamin D is fine. using outdated, normal ranges of 20-100. Optimal is 50-80. What to ask for? I'd like my vitamin D, 25-hydroxyvitamin D tested. I'm concerned about deficiency affecting my mood and immunity. The fix. If D is below 30, supplementation, 2,000 to 4,000 IU daily. Some people need more depending on how low they are. Within 2 to 4 weeks, mood improves, energy increases, bone pain decreases. Within 8 to 12 weeks, immunity improves, fewer infections, mood is significantly better. Your action steps. Here's what you do. This week, call your doctor's office. Don't wait for an appointment. Call and say, I'd like to get these tests. Ferritin, complete thyroid panel, TSH, free T4, free T3, TPO antibodies, thyroglobulin antibodies, active B12V, methylmalonic acid, and vitamin D. If they resist, I have symptoms and want to rule out deficiency before we consider other explanations. This is your right. You're not being a difficult patient. You're being an informed patient. If tests come back normal, at least you know you can rule them out. If they come back low, the fix is often simple. Supplementation, energy returns, symptoms resolve. You're not tired because you're lazy. You're not aging poorly. You have a deficiency, and deficiencies are treatable. Your body isn't betraying you. Your body is signaling. You just have to listen and ask the right questions. Next week, the supplements that actually work, and the ones wasting your money. Subscribe so you don't miss it.